I, Natalie Johnson,
I, Natalie Johnson,
do affirm that I will support
do affirm that I will support
the Constitution of the United States,
the Constitution of the United States,
the Constitution of the State of Colorado,
the Constitution of the State of Colorado,
and the laws of the State of Colorado,
and the laws of the State of Colorado,
and will faithfully perform
and will faithfully perform
the duties of the office
the duties of the office
of Counselor Ward 1,
of Counselor Ward 1,
upon which I am about to enter
upon which I'm about to enter
to the best of my ability.
to the best of my ability.
Congratulations.
Thank you very much.
Welcome to City Council.
Yeah.
Okay. Applause. Okay, great.
Yay, Natalie.
Back to your council. Okay. All right. Thank you. I think that's kind of a first for me, and it's the first time we've done it quite like that. All right. Very good. Thanks for your patience and cooperation. We'll push on. I would like to have a motion to adjourn to the work session.
I move that we adjourn to the work session.
Do we have a second?
I'll second.
All in favor, say aye.
Aye.
Aye. Okay, we are now in a work session. We need to do a roll call, so let's quickly do that technically. Judy, please.
Oh, Judy's muted.
Judy, you're muted.
Judy Morgan, you're still muted.
Judy, you're still muted.
Judy, you want to come out here and do the roll call, or you want me to do it?
I'm good. We just had to, I'm in here with Megan. We're using her audio and my video. And so have her over here and you guys can hear me. Otherwise we have feedback and you guys would lose it. Okay. Council members, Julie Wolf,
Here.
John Shada,
Here.
Judith Chandler. Present. Steve Bremner.
Here.
Oh,
Mayor Pro Tem Nancy Fortune.
Present.
Counselor Natalie Johnson. I didn't hear you, Natalie. Yes?
oh, she,
Oh no, can't hear you. And Mayor John Graham.
Here.
Great. Thank you.
So I think we have a little problem with Natalie
Yeah,
not being able to understand.
what we've got going on.
Okay, we can obviously see that she's here. We know it's a technical difficulty we're working at. Judy, could you go ahead and bring over the
Cass, can you hear me?
folks from the
Can you
hear-
County Health Department,
yes,
please?
Denise.
Name them off for me. One of them is, what's her name?
Susan Whalen. Robin Johnson.
I don't see Susan Miller. She under something else?
Stephen Goodwin.
Yeah, I'm still looking for Susan. She was on earlier. It's not Stephen Goodwin. Okay. So we're trying to find Susan Whelan. Susan, if you are on the call, if you can use the raise hand tool so I can find you on the list. I don't see you in your name alphabetically.
Robin Johnson.
Judy, she's at the top there.
Thank you.
They must have, yeah, this one is? That one? I know, yeah, I know, they both are.
What am I missing?
Keeps coming up.
Oh, here's the attendee. It is. Oh, okay, there she is.
Okay.
I know I don't.
I know, she, yeah, no, she.
Okay, now I think we got her.
Thank you.
All right. So thank you all from the El Paso County Health Department for being here and for your patience. We really appreciate it. And now I will turn the floor over to you. I know Michelle said that you guys have a hard stop at 7 o'clock, which I totally understand. So we will get going.
Let's see here. Okay,
So, good evening, everyone. Susan Lewin, and I speak as the Public Health Director for El Paso County Public Health. Thank you, Mayor Graham, as well as we work closely with Denise House for having us tonight. There's quite a bit of feedback. Hopefully, you can hear me.
See how that was?
Sure.
How that was? So that's why I thought that was.
We have members of our team joining us for good update as well as vaccination update, and we're going to go over some policies related to the statewide health order and the mask mandate, and then open it up for questions. Let's go ahead and get started. Body or Steve.
Thanks, Susan. Can you hear me?
I can hear you well. Thank you.
Perfect. I'll be kicking off our presentation. We'll be giving a brief data overview to vaccine activities comparing El Paso County with other counties and highlighting some of our demographics. Our vaccine campaign has evolved over time. As you recall, from December, January, and February, there was a supplies issue. So we categorize that as sort of the first phase of the vaccine campaign. And that was not unique to El Paso County. That was going on with the state and nationwide as well. As vaccine production started to kick up, we transitioned from a supply constraint to a capacity issue, where our vaccine consortium and vaccine partners were getting ready to have these massive vaccine rollouts. Currently, we've transitioned from a capacity phase into a demand phase, where we're trying to get as many people vaccinated as quickly as possible. So those three categories are sort of the bins that we frame our vaccine campaign timeline through. The supply issue, then we moved on to capacity, and now we're in the demand phase. As you may have heard, the administration had placed a national goal to get 70% of adults vaccinated and 160 million adults in the US fully vaccinated by July 4th. The state has its own goal, which was announced before the national goal. A little bit different. The state has set as 75% of its eligible population to be vaccinated by July 4th. We have about 55 days to go, and in El Paso County, currently we're at 52.3% toward that goal. As you may have heard today, the Pfizer vaccine received approval to include 12 to 15-year-olds, so our eligible population has grown. We're not sure yet if the state goal will merge with a national goal or how this new group that's being added will impact. Right now, we're operating as by July 4th, we need to hit 75% of our eligible population in El Paso County. Looking at recent trends, the screen that we're showing, the highlighted waves with the dots there, that's the number of first doses over time. What you can see right away is most recently, the number of first doses reflecting the number of new people getting vaccinated has been decreasing most recently as the number of second doses increase. So less new people coming in and more catching up with the folks that have already received their first dose. In order to hit that 75% mark by July 4th, we need to vaccinate around 16 to 17,000 people a week. And the most recent 7 days, we vaccinated 7,500. So that reflects the trends of the number of new people getting vaccinated decreasing over time. We'll obviously hope that number to increase so that we can get to that number by July 4th. Unfortunately, El Paso County ranks 10th in terms of the 10 largest counties in Colorado, with the first having vaccinated at least with one dose. When we're fortunate here because we have a strong relationship with our federal partners, they feed us data. So without that, we're at 45%. With it, we're at that 52.3%. But you can see, even if we include the federal estimates, we would only move to 9th place. We want to be ahead of the pack. We do not want to be trailing in terms of the 10 largest counties in Colorado. And now we'll be transitioning to Stephen, who will take us through some demographics and additional information about where we are in terms of vaccinations.
Sure. This slide shows the different age demographics and the time in history as to when the demographics are vaccinated. So you may be able to see on the first and oldest took off quite early, and they are the most vaccinated demographic. So that represents 65 plus. And remember, this is by design. They were the most at risk. Initially, in the period of very low vaccine availability, we were vaccinating those most at risk, which included medical workers in hospitals, and then it went out to nursing homes, and then it went out to the older population. So that's quite a success, but has also set us up for the future. And then if you go down the lines, what you see is partially just by the history of the vaccination campaign and partially by the inclination of the demographics, the younger you are, the less likely that you've been vaccinated, which is, the method we would expect. And if we look at this on the next slide, we can see it even more clearly. So on the next slide, what we show is we show the actual population of each of these age groups, and these are in decade year spans, with the exception of the youngest. Right now, we're only showing 16 to 19, but the blue column indicates the population of that year group, of that decade, of that demographic. And the maroon column shows the number vaccinated. Now remember, this is not a complete data set. In this particular slide, we're not able to show the federal partner data because we don't have the age demographics. And just as the last slide shows, the further to the right on the slide you get in ages, the more likely we have complete vaccination. So the interesting thing that this shows us in our campaigns going forward is that we need to find where the people are to get the herd vaccinated, and where the people are the younger age demographics, particularly in the 20 to 29 age demographic and up. And then again, as Fadi mentioned, we'll be adding about 40,000 eligible in the 12 to 15 demographic. Also, curiously, you can't see it on this chart. You can see it at our dashboard site, but women tend to do better than men generally in self-care and getting vaccinated. There are some advantages, but men particularly are doing poorly in the 20 to 29 group. So that's one demographic that we just aren't reaching. Now, if we look at the next slide and we look at your zip code rate, 80829, just wanted to show you what this represents as kind of an odd looking graphic. But what we did is we stacked up all the zip codes as blue circles, sizing them by the population within El Paso County. And overall, our vaccination rate, which is to say one or more vaccines, is 35.5% at this point in time. And you can see that your zip code is in orange, is at 49.2%. It's one of the very best performing zip codes in the county, which is very interesting. And as Fadi had mentioned now, vaccines have become, vaccines are in wide supply now. So the nature of the battle is changing. Vaccines are becoming our primary tool going forward. And we can see that they're working. There's a number of indicators that these vaccines are remarkably efficient, efficacious in use. We're seeing that since the population, the older population has been vaccinating, we're seeing the age of hospitalizations, we're seeing the age of death shifting younger. However, in El Paso County and in Colorado generally, we're still coming off of a high plateau, and our hospital numbers remain elevated, even though younger people are showing up in the hospital. Because our case numbers are still driving hospitalizations, we still do have hospitalizations. And effectively what we're seeing is we're seeing this disease become a vaccine preventable disease, which is pretty awesome news. Now, prevention and mitigation strategies such as social distancing, masking, staying home when sick, effectively we're saying mask while you're in a public place. They're still in effect, but they're going to be falling away as more and more activity occurs and going to the future as more people are vaccinated. Now, the next slide shows a remarkable thing. I took those same 10 counties. We took the same 10 counties we talked about, and we lined them up on an axis here. It's a little hard. You have to think a little bit about this graphic. But on the vertical axis is the 1 week cumulative incidence. So higher is worse, right? Lower is better. And then on the horizontal axis is the percent of population vaccinated. So what you can see here is the effect that we would suspect as vaccination starts to affect not just individuals and their health, but the entire population. So what we're seeing is a great indication that the more vaccinated we are, the more we'll suppress disease activity. And it's really important. If you think about the virus, it's like a water leak. It's going to find its way to the most at-risk organisms, right? We don't want to be the most at-risk organisms. So this is a great example of how this is moving going forward. So one of the great problems now is how do we get people vaccinated? And the next slide shows a really great study from, and I'd recommend people go out and have a look at it, the Kaiser Family Foundation. They actually did this study initially in December of 2000, before the advent of vaccines. And they basically divided the people in terms of their willingness to be vaccinated into 4 groups, which I think is really instructive for us to think that way. And those 4 groups were, hey, I'm going to get vaccinated as soon as possible. Well, I'll wait and see. I'm vaccinating only if it becomes a requirement. And finally, there's no way I'm getting vaccinated. So when Fadi mentioned our transition through the different phases, that big demand phase was really driven by the as soon as possibles. Now, the beautiful thing about this is you can see they've repeated this survey over time. And in January, in February, in March, in April. And what you see now is we have a dark blue group who have been vaccinated. And the great news is that people are changing their minds, and more people are coming around to participating and becoming vaccinated, which is great news for us. So our focus here really isn't on the definitely not people, it's on those other people who may not think vaccines are relevant to their life or don't understand or have questions about vaccinations. And with that, I think, Susan, would you like to talk a little bit about this transition with our consortium?
Sure, Stephen, thank you. And Fadi and Stephen are part of our data and analytics group, and all of the information is available on our website. So you can access it at your fingertips 24/7 as well. So wanted to provide a little bit of understanding about how we've been approaching vaccinating the most people as safely and efficient in El Paso County communities, including Manitou Springs. We have organized a vaccine consortium, which is made up of our 3 hospitals, Children's Hospital, UC Health Hospital, as well as Centura, and numerous different pharmacies, some primary care practices, Peak Vista, and we have state partners on there as well. We discuss policy and we discuss vaccination strategies for El Paso County. And we've used a triple action plan, and we were utilizing existing infrastructure, including hospitals and pharmacies and healthcare facilities. Number 2 on that triple action plan is expanding large-scale clinics and mass vaccination sites. This was really critical in the beginning because they were highly needed and utilized, but now we're seeing a little bit less demand or people signing up for appointments. And then part 3 of that triple action plan is to increase equitable access to vaccines by reducing barriers. And wanted to focus on that because we are currently have gone from low barrier to no barrier. And so what does that mean? When we first started out, we had to make appointments for everyone. Now there's a lot of walk-ups. We are also utilizing a mobile vaccination van where we are going into communities, meeting people where they are and offering vaccinations. And I wanted to thank the council and Mayor Graham for the leadership and welcoming us to your community, because we do have some clinics that are planned in Manitou at the main hall, and I can get you probably already have that information, and then also working with the Manitou school districts to offer the mobile vaccination van. And through those trusted partnerships where we provide the vaccinations or vaccinators, the resources, and the equipment, we work with trusted partners so you all can do the outreach and we gain more people that are interested in getting vaccinated. And so that's really how we've been steadily increasing vaccinations out to the community, but that is slow and steady at this point in time because we've went from a not a lot of supply and a lot of demand, and now that's kind of flipped. And so currently we are trying everything that we can to make getting vaccinated as easy as possible for whoever wants a vaccine. And our job really is to create the access points. And that's where we have been steadily focusing on. And the mass vaccination sites still existing at the World Arena. And we have a lot of capacity there to do thousands of vaccinations per day. Looking at the numbers, there are some days where there are 4,500 people, but there are some days where we're not getting as many appointments. And then also at the Chapel Hill site as well. But I would say overall that we are having a challenge filling appointments, and that's with the overall vaccine consortium. Therefore, we're taking walk-ins, but would really appreciate any help or promotion with your leadership in reaching out to more communities, because we know that viruses do not know any zip codes or boundaries. And as Stephen had said, that wherever we don't have vaccinated people or that health protection, we know that the virus can find its way to affect someone. So we need help there, and would welcome any other ideas, but we are reaching out to working with businesses and schools and faith-based and nonprofits and anywhere that will welcome us. We even did a downtown Colorado Springs First Friday. So any events, we're wanting to pull up that mobile vaccination van and get people vaccinated, because that is going to be our best protection to limit and stop the spread of COVID. And so we are heavily putting much of our energy there. And I did want to acknowledge that we do have our medical director on the team or the Zoom call, Dr. Robin Johnson, who has been heavily involved in the vaccine consortium, because we also talk about policies, public health, learning, different aspects as we go. There's been a lot of moving parts. And with that, when I say moving parts, there's been probably over 100 different policies that have been enacted or expired and changed throughout the pandemic. And we're going to provide you an update today with Diana May, who is the county's attorney, on where we stand with the current public health order statewide, as well as the mask order mandate. Diana?
Good evening, everybody. My name is Diana May. I'm El Paso County Attorney and help provide legal advice to public health during the pandemic. I'm going to go ahead and start with an overview. Next slide, please. Of some of the different laws that are in effect with regard to public health orders, but then also executive orders. Starting April 15th, the COVID dial, as we've known for the past year, was not renewed. And I'm going to talk about what is in effect right now, but it went to kind of a basic overlay that everyone has to follow, and then allow local implementation of additional restrictions if deemed necessary. I'm also going to cover face coverings, schools, outdoor events, indoor events, and then a clawback provision. In the next slide, please. So the current state restrictions, the COVID dial was not renewed, and local public health can now place any additional local restrictions if they are needed or warranted above what the state requires. At this point, El Paso Public Health has decided not to place additional local restrictions, and that the state restrictions that remain in effect is what I want to cover next, starting with the next slide, please. The big kind of new changes is dealing with face coverings or masks or different type of face coverings. So El Paso County has an incident rate of beyond 35 per 100,000, as you can see. And so the basic rule is face coverings are required indoors. And that's the basic rule. And there's exceptions to that. And what the first one would be is in a public indoor space, which is everything but a person's personal home. If there's 10 or more individuals present that are unvaccinated or unknown vaccinated status, they must wear masks. So the opposite of that is if you have 9 individuals in a room indoors, masks are not required at the present time. There are exceptions to that also. Next slide, please. So face coverings are required in public indoor settings, schools, public areas of state government, and congregate settings, including nursing homes, assisted living, prisons, jails, emergency and medical healthcare settings, personal services, and limited healthcare. So even if and there's an exception noted, face coverings are still required in these indoor areas unless it's specifically excluded. I know one of the big issues is people are asking about schools, and the governor has continued his mask order and in the public health order on requiring masks in schools for children that are under the age of 11. You do not have to wear a mask, but if you're over the age 11, it's still continuing, even if you have less than 10 in a room. So that these are the requirements that are in the place. Next slide, please. There are exceptions to face coverings. One I just talked about, which is individuals under the age, individuals 10 years of age or younger, individuals who cannot medically tolerate, or any of the individuals that the governor has put in his own executive order, which I have them listed on the next slide. It also allowed for, in the past several weeks, 2 additional exceptions to face coverings. The first one is in an indoor space, if 80% of individuals in that indoor space have shown proof of vaccination, then face masks are not required or face coverings are not required. The next exception would be for restaurants. If they have 85% of restaurant employees that are vaccinated, then masks are not required. So those are 2 different percentages and apply differently. 85% is required for restaurants, 80% for the general public and indoor spaces. As I indicated, the governor also has various different exceptions for masks that I'll cover in the next slide, please. He has a variety of different areas that go through where there are exceptions. And I'm not going to go through all these, but you know, what may be relevant a lot in your world is an individual giving a speech or broadcast to an audience. So it could be, you know, the mayor speaking at an event, or it could be one of the city council members speaking at a board member where you can temporarily remove your mask. So these are all the additional exceptions that the governor has kept in place for masks. Next slide, please. The next area that the public health orders and executive orders covered are with regard to schools. Basically, it's the same. Nothing has changed with schools. Masks are still required for children 11 and older. And the public health order also made it abundantly clear that local schools must cooperate with case investigations and outbreaks with public health. They also added a provision and kind of codified an unwritten rule that they had, that if schools are fully remote based on a school closure by health, the school cannot have extracurricular activities. Next slide, please. The next 2 areas deal with outdoor events and indoor events. Outdoors are pretty simple. The only restrictions that are on outdoor events is if you have 4 different things. You have an outdoor event, you have it seated and it's ticketed, and you're in a venue over 30,000 square feet. Public health, the state public health has made it very clear this is for the organized business related events, such as the Rockies game, or such as a concert at the Vibe Stadium, or a concert at Red Rocks. If these are for where a business is selling seated tickets for assigned seating. The outdoor events also allow for 5-star certified businesses and prior variances to continue. I do know that your city manager, Miss Denise, has been involved with the 5-star program, and we really appreciate her collaboration with us on that. But the good thing is that any previous 5-star certifications or prior approved variances do continue. So again, just a basic overview on outdoors. You don't have to wear masks, and unless you have one of those seated, ticketed outdoor events over 30,000 square feet that is a assigned seating event, you do not have any additional restrictions placed on you. If it does fit into that category of the outdoor seated events, you do at that point need to consult with local public health. Next slide, please. The kind of more complex area is dealing with indoor events. Okay, starting with masks. We went through when masks are required. So general rule is masks are required indoors unless you meet one of those exceptions that we talked about. So that's an overlaying requirement for indoor gatherings. Other than that, indoor gatherings are divided into 3 different sections: under 100, 1 to 500, and then over 500. If you have an indoor event less than 100 people, no longer do you have to have the 6-foot distancing between people. So, for instance, if someone's having an indoor play at your school, you don't, and you have less than 100 people, there does not have to be 6-foot distancing between those individuals. They still have to wear masks, however. The next tier is the 1 to 500, and in that area, you either have to identify who's unvaccinated or unknown vaccination with your vaccinated, or you are going to have to presume everyone's unvaccinated or choosing not to identify. If you can differentiate between the vaccinated and the unknown or the unvaccinated, you don't have to have that 6-foot distancing with the ones that are vaccinated. For instance, if we had 300 people in that same play, and you knew 200 people were vaccinated, 200 people do not have to have 6-foot distancing between their family group. But the other 100, either that are choosing not to disclose or that say they're unvaccinated, they would have to have that 6-foot distancing. The next, it would be for events over 500. They must obtain a variance from public health and from the State Department of Health. Again, as with outdoor events, 5-star certified businesses and approved variances continue. Next slide, please. There are some exceptions to indoor gatherings over 500. So for a business that is a place of worship or an associated ceremonies, they do not have to get that variance if they have over 500. You do not have to have permission from local or state. If you have retail services, we call those kind of the big box stores, you don't have to have permission. Restaurants further do not have to have permission, that have sit down dining, that do not have an unseated area where 100 or more people can gather, such as a dance floor. And then schools and proms and graduations do not have to have the variance approval if they meet the guidance that the state's put into place for those proms and graduations. We work very closely with your school district, with Dr. Dominguez, and it's our understanding that none of your schools are having any indoor proms or indoor graduations that would get into the level over that 500 that are indoors. Next slide, please. The one additional area that we wanted to talk about is the state has kept what I'm calling a clawback provision. And what that says is that if hospital capacity begins to threaten to exceed 85% of their capacity, the state could require counties to place additional restrictions within the county to mitigate disease transmission. And this would be something that the state would reach out to us to have a conversation with us about that. If we start threatening that 85%. Next slide, please. So that's the overview of the law as we know it right now. I do want to state that the public health order that deals with the indoor and the outdoor events is in effect until May 15th. The mask order was extended until June 2nd. So we anticipate probably on June 15th, hearing additional information on whether Governor Polis is going to continue through the public health orders and executive orders, the restrictions on those areas of outdoor events or indoor events. Thank you.
Thank you.
And that's the end of our presentation. So with that, we can open it up to some questions if that's your preference.
Okay, counselors, do you have questions? And I can't see everybody, so I'll try to. Okay, Mayor Pro Tem, please. You have the floor.
Thank you. I do have a question, and that is in Manitou, as you know, we do have an outdoor mask mandate currently as well. And that is in part because we have so many people in a crowded downtown area from other states that perhaps have a higher incidence of COVID than we have here. So even though we have a high incidence or high compliance with vaccinations at this point, it's still very problematic on crowded days, which is a lot of them. Additionally, if you look at, I don't know, I'm hoping that public health person can tell me, I think we've been seeing between 13 and 17 COVID positives in our city in 80829. And given the high incidence of immunizations, is that a high incidence of COVID positives? So I'm trying to balance that because I do think we have a somewhat unique situation here.
What I'd like to ask is our medical director, Dr. Johnson, if you could take that one, please.
Sure, I'll take that. So it's a little bit more complicated than just one and done with the vaccine. We actually need to reach that saturation where we can break the chain of transmission. And so while we continue to have a high incidence of the virus in the community, it does put pressure on those who are not vaccinated, so that there still is that transmission. So we would have some expectation with our present incidents within the county and the test positivity that we would still see those positives in your county in your municipality as well.
And I don't know, Stephen or Fadi, if you have the dashboard, it pulls it up by zip code if you go to our website. But I think Dr. Johnson's point is well made too. It's complex as it relates to the question of if you're asking if in Manitou Springs having 16 to 17 positives within your area, and I think your population is what, 6,000 or?
It's about a little over 5,000.
About 5,000. I would ask Fadi or Stephen to help out there, and we can also do a deep dive into more details of the.
Yeah, and to simplify it, I just want to know, given that it would appear that we've got a fairly high incidence of positive COVID cases, but we also have a high incidence of immunizations. I just want to know if there's any and I know it's very complex, obviously, if there, because I would assume that may be because of all the visitors we have from outside of our community. And so I wanted your professional opinion on that, because that goes directly to our mask policy, I think.
Yeah, well, and I would add to that not only do you have a high number of visitors into your municipality, but your residents are going to leave Manitou and come into the rest of the county. So the more that we mingle, the higher our interaction rate. Then there's just that much more exposure. So with the incidence being still fairly high in our whole county, and maybe Fadi, you could speak to that. I see you pulled up our map.
Yeah, we would think about it the same way we would think about El Paso County's placement within the state. As summer comes up and activity increases, El Paso County is going to be not unique to El Paso County. We're going to have in and out from other counties surrounding us, as well as counties that are further than us. So we in fact talked about this in preparation for this meeting about Manitou Springs' unique position in that there's a lot of traffic coming in and out. It's one of the things that we want to motivate folks. We don't want El Paso County in general to be a place of low vaccination. We want El Paso County to be a place of high vaccination, so that when folks do want to visit and come into the county, there's confidence is that the risk is minimized as much as possible. So I would think of Manitou Springs the way that we would think of El Paso County in general within other counties and its place in Colorado. As you know, it's sort of like a pull and tug. No one place acts alone in their sphere, especially not a place like Manitou Springs.
So while Manitou is leading some of the vaccination rate within El Paso County is only 10th for our large counties. We still have quite a ways to go to reach that goal of 70%.
Right, and Fadi, as he's showing up here, this is he's looking at cases that have been reported since 4/1, and you can see we'd have to do a little computing here. There are 62 cases out of a population of 5794 versus all told in El Paso County 9354 out of 118,000 or something. So you're relatively low. I mean, I have to run the numbers here to look and see, but I'm thinking that rate is relatively low. But your point about Manitou being a magnet for people in El Paso County, in the state of Colorado, in the United States, around the world is entirely true. So you're going to be drawing visitors in, and protecting your own citizens with vaccination is the number one methodology here, because you're going to see visitors from all over the world. So I think your rate, when we compute your rate, it might be quite nice.
Any other questions or comments?
And I think, if I may, the idea of wearing masks outside is now going through a debate phase, as you're hearing, and I think CDC may be trying to clarify some of that in the coming weeks, and they'll give us some better guidance on that. We know that outside is much safer than inside, and we know that well ventilated inside is better than not well ventilated inside. So there are a couple of just main factors there.
So after this discussion with you guys, and I do appreciate it, your data is very interesting, and obviously we have to condense it down to what's right for Manitou Springs. If you were betting, would you say the indoor mask mandate is going to continue past June?
I do, I don't know. And so how that works is there's many policies that I don't have a good read on what's going to happen within the next 3 weeks. I mean, I know that there's been a lot of changes, but what I do know is that the governor has a policy group and will reevaluate if he lets the statewide mask order expire or if it's going to be renewed. It is currently will be active until June 2nd. And so I wish I could give you a better answer, but I can't bet on that one.
Thanks.
I would say though, with Manitou Springs and your vaccination rates, and you guys are doing very well to, I would ask to continue working with us and whatever we can do with innovative ideas to continue increasing vaccinations among your communities. You all know your community best and the best ways to reach your community, and you guys have trusted relationships. So we're fully supportive and will help you out however we can to bring more vaccines or at events, whatever is helpful to you. We will look forward to working with you.
Could we discontinue the screen sharing so we can see each other's faces, please? Great, okay. Do we have other questions and comments from council? Okay, I guess we don't. I guess it's quite lucid then.
I would say that if there's any questions at any point in time, Denise Howe has a direct connection to us. I mean, she has my email, she has my cell phone, and we are happy to answer any questions, technical questions. We are still doing a lot of technical assistance with businesses, and as things change, and we're willing to support or answer any questions at any point in time. We do have a COVID recovery at elpasoco.com email where we work with numerous different businesses in the community. So we're always available. And if you would like us to come back, we're willing to come back. And we thank you for inviting us and your tremendous leader throughout the pandemic, because we know that it has been incredibly difficult, especially in leadership roles and making decisions. And there's been a lot to navigate through. So thank you for your leadership.
Thank you very much. We appreciate this information. It's really good. You had some great data. Love those graphs and that information. It's very, very well done, very helpful. Before you go, I'm wondering if it might not be a good idea to bring our intern police chief, Bill Otto, in case he has any questions, because he's really the guy that's saddled with enforcement. And that's really the thing in the back of our minds that we worry about. So if I could ask you to hang in there, and Judy, if you could bring Bill over and let's see if he's got, if he has comments that he'd like to either advise counsel of things that we haven't seen, or perhaps he has questions for the county health people while they're here.
And I would say if he's not connected already, we do have an emergency center coordination kind of build out of emergency response where all of our municipalities and law enforcement are involved, and kind of that open communication, and would be happy to give him my cell phone number and work through any enforcement issues and how we're going about that.
Okay, super. And that might be sufficient, but since you're here, I would like to give him an opportunity.
Sure.
I mean, we're striving to do the right thing. That part of the problem is that we give Bill the task of making sure that we've done the right thing. So we want to have something that's makes sense and is actionable.
Well, while you're bringing him over, could I ask another question, please?
Please go ahead, Nancy.
From the El Paso County Public Health Department, are any other jurisdictions doing anything different currently than the state rules?
Yes, so I mean, throughout the state of Colorado, there's numerous different differences among the counties, but in El Paso County, I'm not aware of any differences in El Paso County.
El Paso County is just following what Governor Polis has put out at this point.
Yes, and we work very closely with the state in good communication, and we are heavily connected with numerous different cross sectors as well as law enforcement entities on helping people be successful with current rules and regulations and policies and disease mitigation efforts. So there's still, I mean, it's not a free-for-all. There's still a lot of measures that are put in place. And I think that sometimes when the message gets out there, well, you know, some municipalities or counties are not going above and beyond what the state is doing. There's this perception that it's a free-for-all, but there still are some really good practices, including the mask order through May, and then it will be reevaluated. But there's a number of differences throughout the state of Colorado.
Thank you very much. Good. Chief Otto, I wanted to give you an opportunity to make comments, or if you had questions for the health folks, or if you need to advise counsel of something that we've overlooked, this would be a good time for you to make those comments.
Yes, sir. We've got a pretty good handle on it here at the PD, what we're doing, how we're enforcing stuff. I will definitely take Ms. Whelan's number for future reference. Just so you know, we haven't had any kind of complaints that have come in reference to the COVID stuff. We've been following the same script on how we enforce it. And to be perfectly honest, we haven't had any violations since I can remember. And that goes back to July of last year, where we've actually cited somebody where it actually had something to do with a mask violation, either started the violation or ended up as a violation.
All right. So it sounds like this would be, things are manageable currently, and we would expect them to not probably get any worse.
Correct, sir.
Contain okay management. So we're not asking the impossible of you. Okay, good.
And I would offer too, with Chief, with what you had just mentioned, what we're finding out throughout El Paso County and all of the different towns and cities within is that the majority of businesses want to do the right thing. Sometimes they need a little bit of help and technical assistance on how to get there, but we're not receiving critical complaints where after we've had a conversation and been helpful, that they're resistant. Now, I will say through the pandemic, there has been elevated tones and frustration that comes out, that we've been working through that, but there has been some volatile situations. But I think it's a lot to take in. But we've been able to work through that, and we are in a good place. So I look forward to working with you, not only with COVID, but there's numerous different areas that we work with the city of Manitou on different community health policies. So I look forward to furthering our work together.
I appreciate that. And you can definitely give me a call anytime you have information to share or anything to do with Manitou Springs on the public safety side.
Great. Thank you, Chief. Thank you, Susan. Anyone on council, or Denise, I see you have your hand up.
Yeah, I just want to thank Susan and her team, because they are always there if we have questions. They're very supportive, and want to just reach out and say thank you. As Susan says, I have her cell phone. We can call, we talk. The other thing I want to recognize is both Megan and Susan and her team for getting the vaccines organized for tomorrow night here at Memorial Hall. And it's the one-shot vaccine, and we'll continue to work on that to make sure that we can provide this service here in Manitou. So I just want to say thank you to Megan for her leadership and for public health. So thank you.
Thank you. Council, do we have any additional comments or questions for the team from El Paso County Health? Natalie, please.
I don't have any questions for them directly, but just the idea that I look forward to clarity around some of these measures, and then additionally how this actually looks like in terms of implementation. And so just to mention that, again, are restaurants checking vaccination cards? How are we handling things as we move forward? So just the idea that I have a gazillion questions to talk about as a council, but just wanted to throw that out there.
And I would say, give us a call on that, and that would merit kind of more of a in-depth discussion. I will say that there hasn't been processes on the how that lays that out for employers, but we can talk about that as it relates to the restaurant industry, and then also some ideas around public spaces and how people are demonstrating that they're vaccinated, because that's a very common question. But that's something, if you want to give me a call and connect with Denise, we can dive into that.
Great, thank you. Denise, I think one of the takeaways we want from this evening is for council to provide sufficient direction to city staff as to how to go forward with this. I'm wondering here if we could let the folks from El Paso County Health go and then continue our discussion, or would you like to have the discussion while they're still here?
Know that they had a very hard deadline and they're already past it. So I think if we go ahead and let them go, right. And then
I'm sorry, I can't understand you. Could you take your mask off, please, just for.
They have a very hard deadline. They needed to leave 20 minutes ago, so they've been gracious enough to give us some additional time. So I would say let's go ahead and let the county health individuals leave, and then we can continue the discussion.
Sorry, Denise, you're pretty garbled. I think you said they had a hard deadline. So
yes,
we should let them go? Okay.
They have a hard deadline, so I would say let's go ahead and let them go, and then we can continue.
Okay, so we have a hard deadline. Okay, we appreciate your help, Susan, Robin, Stephen, Fadi, and hope I got everybody there. So thank you very much. We may be making a phone call to you. So
thanks so much. It's a pleasure to be able to help.
Thank you.
Thank you. Take care.
Bye-bye.
Thank you. We appreciate it very much. Okay. Council, I think what we need to do now is to decide what direction we want to give city staff so that they can implement whatever we feel is the appropriate policy for mask wearing. I guess my takeaway from the discussion part of it was that El Paso County is way over the ceiling. I mean, the masks are required indoors if we've got more than 35 cases per 100,000 people. And in El Paso County, it's 231 cases, roughly 6.5 times what it should be. So in my mind, it seems like we still need to require masks indoors. This changes is pretty dynamic. I know this has been hard to enforce, and we've relied largely on compliance. The police seem to have handled it pretty well. We've had minimal complaints. It hasn't been a perfect system. You know, my thoughts are we continue to require masks indoors. Basically, what we've done is we've required, or we've asked businesses to require that if people come into their businesses and refuse to wear masks, they can ask the police to remove them for trespass. That seems like it's worked reasonably well, and as the chief said, it seems like it's been relatively minimal. That'd be my thoughts. What are yours? Denise?
I agree with Mayor Graham. I think that's very prudent.
Okay, so Mr. Shada.
I agree with.
Okay, thank you. Okay, okay. Denise, please.
Yeah, I think the indoors is still required by the state. The question is, are.
Sorry, Denise, I can't hear you. I don't think. I don't know if other people, I know Counselor Chandler, who's in the same room with me, can't hear you either, so.
I think the indoor, can you hear me now?
A little better. Could you take the mask off, just, please? It just, yeah.
Indoor mask is still required by state. I think the question is the outdoor mask requirement, which we have as Manitou, is that that you're required to wear a mask outdoors. So I'm asking for direction. Do you want to keep that, or do you want to change that? That is the direction that we're asking, because that's changing, as you know, on a regular basis. And that's the one that's really hard to enforce, as Chief Otto will state.
I had difficulty hearing that. I'm sorry, but was it? Okay, Counselor Chandler heard that. She'd like to respond. Counselor Chandler, please.
I did hear.
You're muted.
Oh,
no.
Can you hear me?
Shows you muted.
Okay, people, yeah. I was muted on purpose, but they can hear me.
I'm sorry. Okay.
Yeah, because I'm on Ethernet. Sorry about that.
Okay.
I think we should continue the mask mandate for outdoors as well, but not worry too much about strictly enforcing it. For the reasons that Mayor Pro Tem brought up, we are a tourist destination. We are in close proximity to each other when we're downtown. And I echo what the mayor said about the El Paso County rates. So I would be, you know, a fan of really enforcing it. But if we have some people come into town and they see the sign and they continue to wear their mask, I think that's a good thing for now. That's my input. Thank you.
Thank you, Counselor. Mayor Pro Tem, please.
Yeah, I hate having a law that nobody follows. However, I think the point, which is pretty much happening, because every day you go down into Manitou downtown and there's fewer and fewer people with masks on. I would like to hear what the chamber has to say about the businesses. But I am inclined to agree with Counselor Chandler that for the time being, perhaps for the next month or so, we leave it in place, because I do think the signs coming into town may affect some people. And given that we have, and I also think that we need to continue and perhaps even increase our health outreach to get our own population immunized. That is absolutely key to this. And if people come to our town from areas where, whether it be Colorado Springs, El Paso County, or Texas, who are not immunized, then it's kind of on them. But I think we need to do everything we can to get our own people immunized. So I applaud whoever got the van here for tomorrow night. I think that's a wonderful initiative, and continue to do, and Mayor Graham, you put a PSA on Facebook last week. I thought that was great. I think we need to continue to do those sorts of things. So for the moment, I would say leave ours in place at least through June 2nd, and then perhaps revisit where the data is, because the data is changing so quickly. And the recommendations are changing so quickly, so we'll be chasing it. I would love to just say, let's just go with the state rules. But I think our town is so unique that perhaps that's not right for us. So that's my thought. Those are my thoughts. Thank you.
Thank you. Councilman Bremner, please.
Yeah, oh, I'm getting a lot of echo here. I agree with Mayor Pro Tem Fortune. I think we should keep it until like June 2nd or so, and then adjust as accordingly. I don't think it should be enforced outside. I don't think that's feasible. I don't think would be productive either. But just to keep the rule in effect would be good enough. Thanks.
Thank you, Councilor Bremner. Councilor Wolf, do you have comments?
Well, I agree with everything that's been said. And I just wanted to throw out there, because I thought this was perhaps a helpful idea. I read that there are some vans providing vaccines going to beaches and stuff. And I thought, oh, maybe we could, some of the sports, you know, the football games or whatever, I guess this is not football season, but if we have any, you know, gatherings or, you know, festivals in town or the wine fest or whatever we're going to do, maybe we should also have a little vaccine booth or a little vaccine van available, because that might encourage some folks who otherwise might want to not bother to go out of their way, but if they're already at a gathering. So I thought that was a cool idea, but I'm in support of everything that's been said. I think it makes sense to keep the outdoor mask requirement in place for all the good reasons that have been stated already.
Great, thank you very much. It sounds like we're pretty much coalescing to some agreement here, so I think that's probably good. Mayor Pro Tem had suggested that we ask for comment from the Chamber of Commerce, I believe. So I'm thinking if Leslie Lewis is in the audience, Judy, if you could bring her over and give her a chance to comment on this. And then I think probably we're at a decision point here.
Oh, good evening. It does look like my camera's telling me it won't start, but thank you very much, Mayor Pro Tem, and all of Council. For inviting me over. Talking to the businesses today, we didn't talk about the outdoor mandate. We really talked about the indoor mandate. And while there were some that said they think that most people have been vaccinated, that they're employees, and so they're okay if people, if the mask mandate indoor goes away. The majority of them said, no, we need to get further down that vaccination road before we remove the indoor mandate in stores. So I think that's probably the loud and clear. And the other thing that I heard from a lot of the businesses is when there's a mandate in place, it's so much easier on the employees. When that mandate goes away, people come in and don't want to wear one. And if the employee's asking them to put one on, some people get very hateful. And so having the mandate makes it much, much easier on them.
Good, good, thank you. Council, does anyone have a question or comment for Leslie? Okay. Looks like we don't. Leslie, thank you. Those are good insights. We appreciate your comments.
Certainly, thank you.
Right. So, Council, looks like we pretty much coalesced where I think we have policy, or I mean, we've set sufficient direction for the city. I see Denise nodding her head, and I believe Chief Otto can live with this. So I would suggest that we consider this direction given. And as this is a work session, we don't need to vote on it. I would, unless there's objection, I'd call the matter concluded for this evening. Okay, great. Well, why don't we take about a 10-minute break and come back and we'll finish up. Does that sound okay? Okay, so it's about 7:40. Thank you. Yeah, I know this. Okay. Let's see, who all we have? Okay, Julie's coming back. Mr. Shada. Okay, we've got all 7 council members now. And okay, I guess we can go ahead and get started. Okay, so our next item of business is discussion of the Keith Haring Art Fitness Court project. It's an update. And Denise, do we have Delane here for this? Okay, so Judy, could you bring Delane Redvick over, please?
He's on his way.
Okay, great. Hi, Delane.
All right, okay.
Good. How are you, sir?
It's been interesting tonight.
It's we've had quite a few gremlins in the system tonight, so hopefully we
Yeah.
got them all ironed out.
Yeah, there were a few gremlins this morning. We brought 2 more public sculptures to Manitou. And it started off rough, but we got them installed. So I hope everybody gets to enjoy those.
Okay, great. Well, thank you for doing that.
Yeah.
Good. Okay. Well, we're here to talk about the Keith Haring Fitness Center, and so we'd like to hear from you, Delane.
So there was a bunch of stuff in the packet. So I hope everybody got a chance to review that. I think one of the most important things was the document that Karen Birchtold put together on how the Haring project fits in with Manitou's stated goals. Did everybody get a chance to see that?
Yeah.
Yeah.
I think so. Yeah. I see everybody nodding their head. Yeah.
Right. We've had 6 months, half a year to kind of like think about this. I think everybody remembers back in December that we presented this project to City Council. We got the resolution to support the application. And I think maybe to everybody's surprise, we won. Out of all of the communities in Colorado, we won. So the next stage was to start funding and to get the resolution from City Council to actually commit to the project. Some of the biggest problems, of course, have been site selections. And although PERB at first supported the project because obviously it's recreation, they eventually decided that they didn't want to give up grass. I think that was the main reason. I've also spoke with the parking board, and of course, nobody wants to give up parking. So without giving up parking or grass space, it's kind of hard to find a public spot for this. We haven't been able to find a private landowner to donate something. So if anybody has any questions for me, I think that might be the best way to start.
Okay, all right, that sounds good. Council will open the floor up here. Does anyone have questions or comments? Nancy, I think you're first with your hand up.
Yeah, comment and then a question. First of all, thanks for your, taking on this initiative. I think it's an amazing initiative, and I think you're absolutely correct that it is totally perfect for Manitou, except that it requires land that Manitou is short of, and you just identified, the little land we do have is very highly valued by various sections for different things, whether it be grass, parking, no concrete, etc. So for that reason, and that's my primary concern with it. But there's a lot of little concerns I have, but they are dwarfed by the land issue. So with that, you mentioned both in your article in the Pikes Peak Bulletin as well as in the packet that you have been negotiating with Colorado Springs, and I'd like to know where you are with those negotiations, and the likelihood that the National Fitness, whatever it is, and the Keith Haring Foundation will go along with that, since they were the ones that selected Manitou apparently to begin with to apply. So I'll go on mute and take your answer. Thank you.
Yeah, so a couple months ago, when it looked like nobody wanted to give up space, I reached out to Trent, our partner with the National Fitness Campaign, and I asked him, if we consider the Pikes Peak region part of Manitou, then can we consider a site, outside of Manitou's borders, but still within the Pikes Peak region? And he checked with his board, and it's a possibility. So we've already had a Zoom call with Karen Paulus, I think that's her name, from the Park and Rec department in Colorado Springs, and we had a really good discussion about Plan B, which is if Manitou can't find a spot for it, can Colorado Springs find a spot for it? And would that, would the award that Manitou got, could that be transferred? And so far it looks good, but everybody says that Manitou has the award and Manitou has to say no first. So it would actually be helpful to know sooner rather than later about this decision, because the National Fitness Campaign already gave us a 2-month extension. Some of there are only 10 of these projects in the country, only 1 per state, and most of them have already found their funding. So in order to give Colorado Springs a chance, or the Pikes Peak region a chance, we have to get going at lightning speed again.
Councilor Bremner, please.
Yeah, I think it's a really good project. I just am curious, who is saying no because of grass Memorial Park?
We got a letter from Parab saying that they don't support the project, and one of the reasons they cite was not wanting to give up grass. Or maybe another way to say that is they didn't want more concrete.
That might be Councilor Chandler, please.
Oh, thank you. I'll have to take off my mask for this. So for the reasons already mentioned, the concrete, the grass, the parking, everything that I don't need to repeat, I feel that Colorado Springs is a better fit for this particular type of exercise, outdoor exercise equipment. However, I do really want to thank you and really thank the foundation and thank the process, because we have gotten several emails from citizens who really support this. And I thought, well, you know, we are a little small landlocked town. And, you know, I was thinking it really has stimulated me to think about how could we incorporate some of those ideas in this town. And I think of some individual fitness stations and mindfulness stations around town, working with Parks and Rec might be a better fit for our town. So while I'm a no for the Keith Haring project, I just really want to thank the process for opening my mind to ways that we can make something else happen, and because we are a health and wellness town. So thank you for that, and I really hope that it works out with Colorado Springs, because I think that would be an awesome and appropriate place for it.
Okay.
Thank you.
Thank you. Other comments from council? Mr. Bremner?
Yeah, I'd just like to express my voice as a yes for the project, and also looking at our demographics in Colorado or in Manitou Springs, with about 25% 65 and older, including myself. I think it'd really be helpful, you know, for the fitness of people, because we all are going to reach this age eventually, is you know, to keep people active and moving around, I think is a positive thing. And I think it is appropriate for Memorial Park. And I just like to, I understand that Parks and Rec is said that they won't support it, but I think we can probably, if we have enough support on city council, we can go forward with it. That's just what my view is right now. Thanks.
Yeah, I'd like to jump in and say, I think ultimately city council can make the decision. You take, the precedent has been set before where various groups didn't approve of projects like the pavilion in, I forget, pavilion by Monte Factor, I forget the name there. You know, when that wrought iron went in, I think most people were opposed to it, but it went in, and I think now the community is fine with it. There were two spots in the Memorial Park area that were narrowed down, you know, as the two final spots. And one was the 4 parking spaces and a little bit of grass at the corner of Lovers Lane and El Paso. So I think everybody knows where there are 5 parking spaces there, but this would take 4 and some grass. That was one spot. The other spot was at the corner of Old Man's Lane and Manitou Avenue, kind of like near where the trail is going to be, near the bridge. That would also take up a minimum of parking spaces, no grass, and it would just have to be sort of like sewn into the conversations with Hiawatha Gardens. So those were the 2 spots that kind of ended up as the final choices.
Great. Thank you, Delane. I guess from my perspective, we've struggled with trying to figure out what to do with the Hiawatha Gardens property for quite some time, and that's sort of a work in progress. Yeah, I mean, and it's taking quite an involved effort. I ask your patience and understanding on that. So, you know, my feeling is we really need to decide what we're going to do with Hiawatha Gardens before we commit to doing something else with the real estate down there. So I've got some reservations about the Keith Haring fitness court. In looking at it, there's some temptation. It's a neat idea in some respects. It comes back to the old real estate problem: location. And you know, we use Memorial Park for a lot of community events, you know, festivals, and I think any encroachment on the use of that land is going to hurt us in other areas. So, you know, at this point, I'm not really in favor of the Keith Haring the fitness court, given the locations we have it in. I think maybe in Colorado Springs would be a great location. I think there might be places where it would be you know, very well suited. And looking at some of their information, they talk about I think one of them maybe was an example in Longmont or Loveland, Colorado. I think they said the average use time was like 4.5 minutes, and people burned up 77 calories. And that's a step forward, but would we really, would Manitou residents use that more than some other application for public land? So I have reservations about that. Other council comments? Well, I guess just to kind of get a temperature reading on this, if we were to raise our hands and show whether we're kind of leaning in favor of this or leaning in opposition, I would ask council to show some direction. So I'll start off on the positive. Council, show of hands if you're in favor of pursuing the Keith Haring Fitness Court project. Could you raise your hands if you're in favor? Steve, okay. Thank you. We have Mr. Bremner. And those who are opposed or at least reluctant, show of hands, please. Okay, so we've got 6-1 vote there. So I would take that as direction from council that we don't want to pursue the Keith Haring project for Manitou. But I think there would be sentiment to perhaps provide support or encouragement to Colorado Springs to do that. Okay, so I'm seeing, yeah, okay, I'm seeing a lot of heads nodding there. So Delane, to cut to the chase, I could pretty easily imagine that maybe Manitou Council would ask Colorado Springs Park and Rec to sincerely look at the fitness court in a Colorado Springs location. And I think much of the argument is it's location, location, location. They would have the space to do it. And it'd still be a credit to your efforts to do it. What are your thoughts, Delane?
That'd be awesome if you could get maybe a statement to sort of say something along those lines, and they can pass that statement on to Trent in the National Fitness Campaign. And then they can do whatever they need to do to officially transfer it. But I think that's what they need next, is some kind of official statement from Manitou's City Council saying we pass.
Okay, we see value. It's just that we're so constrained geographically, and we've got other projects too that we're looking at that have been around for a while, like the Hiawatha Gardens. Council, I guess my suggestion is the city send a letter in cooperation with, get some direction from Delane so that he has a little ammunition to continue to pursue this with Colorado Springs and with I guess it's the National Fitness Campaign. Okay, yeah. All right. Mr. Shada, you have a comment?
Mr. Mayor, I was wondering whether you might be able to kind of draft our letter of encouragement that Colorado Springs pick the project up and let the National Fitness Center know that we're passing on it at this time. Is that possible?
John, we're having trouble hearing you. I could bear. I think you asked me to draft a letter, but
yeah, I was asking you, Mr. Mayor, to draft the letter, handing it off and encouraging Colorado Springs to go ahead and try and implement the project for our region.
Okay, I would be willing to do that if that's council's pleasure. Okay, I see. Okay, I see heads nodding. Is there anyone opposed to that strategy? I see no one opposed. Okay, so what I would suggest then is that I get with Delane tomorrow or as soon as possible, and we draft maybe 2 letters, one to the National Fitness Campaign, is it? And then perhaps one to Colorado Springs Park and Rec.
Great.
Delane, I'm looking to you for a little advice here. Does that sound like strategy?
Yeah, so I'll send you an email. The other key player is the Colorado Springs Health Foundation. Natalie helped write this grant. We actually got $50,000, and we don't want to lose that either.
Okay.
So we'll send something to them as well.
Okay, I think that's agreeable. So if council has no objection, we'll take that course of action, and we'll get that knocked out here in the next day or so.
Awesome.
Is that okay, Delane? So you and I will be in contact here tomorrow, or perhaps even later tonight, if that sounds agreeable.
All right.
Okay, council, okay, I guess we're good with that. So, okay, Well, Delane, thanks. And I know it's a lot of work and you've been very involved and you've opened our eyes on some things. So we do appreciate it. So just this probably just didn't seem like the time and certainly the place for it at the moment, you know. Great. So thank you.
All right.
Great.
Bye.
Bye-bye. Okay, council. That brings us to council correspondence. Does anyone have anything? Mayor Pro Tem?
Yeah, I just was in discussion with folks on El Paso. It continues to be problematic. It's a speedway. There are a few, there's a sense that if the, police were stationed there periodically to get speeders, if there was a few tickets provided, to just kind of get it under control. And look at some other options. And I know Roy is looking at options, but this is a continual, it's just treacherous for people, for walking, biking and driving actually. So I think if we could get some action, that would be great. Thanks.
Okay. Great. Thank you, Mayor Pro Tem. Does anybody else have anything? Natalie, this is where you get to tell us what you've been up to all week. So.
No, I actually do have something. We kind of mentioned it in the meeting, but the school district is also having a mobile vaccination clinic on Friday from 8:30 a.m. to 12:30 p.m. up at the high school. And just to clarify that really is open to the public, because in some of the literature that came out, it talks about staff and parents and kids, but it's actually to the entire community too. So.
Okay, great, thank you. Councilor Wolf, please.
Thank you. I just want to suggest that at a future meeting where we have our city attorney, that we get some guidance on what options we have now that we're lucky to have Natalie with us, because she's on all these boards and commissions, and I have a feeling the attorney will say she either has to recuse herself from voting on anything having to do with those boards, which is a little awkward, or that she needs to resign. And I also want to ask the city attorney on a related note whether it's appropriate for the city administrator or any city employees to actually be on a committee or a board or whatever it was, something that Denise was listed on. And that's not, I don't think that's right. Anyway, so I just wanted to see if we could have those issues somewhat related come up for us on an agenda item sooner rather than later, so we don't get in trouble in terms of what Natalie might be asked to vote about.
Okay, all righty. And I would mention that when we set up the council liaison positions at the beginning of the year, Denise was assigned several liaison positions, so it's not that that's a big surprise, but I see Denise, you want to respond?
Yeah, I do want to respond for that, and I did not vote on that whenever they did that vote. So they put my name on it, but I do not vote on anything that they do. I'm just the liaison for them. So that is different than being on the board.
Then I think, Denise, you should ask them to take your name off. That's not right.
Okay, and I can. I did not notice it, Julie, until just tonight. So
okay,
I do that.
Yeah, no big deal.
But I do not vote on anything, and you can ask them and you can look at the minutes. I did not vote.
Okay, that's great. I think that's appropriate, just so long as your name doesn't show up, because I don't think that's right. But thank you.
Any other? Natalie?
I just wanted to let you know that I will be resigning from the URA board tomorrow.
Oh,
so that will be happening.
Okay. So. All right. Well, good to know. Thanks for being forthcoming. All righty. Anyone else? Okay. If not, let's go on to the city administrator's report. Mr. Cheney.
I'm going to speak for both of us because it's kind of hard to hear us. Okay. So there's a couple of things. Ruxton is going to be restriped on May 17th through May 19th. So I know that will cause a little issues with traffic, but we're getting that restriped for the summer. The Cannon Avenue and Park, we're doing an ADA in the next month. So that will be some ADA work, and with the sidewalks, I just want to mention that. The vaccines tomorrow night is from 5 to 9 here at Memorial Hall. And then I do want to wish the school and the football team, they are playing in the state championship on Friday, and I wish them good luck. They're doing a two-way state championship, and I'm planning to be there to cheer on the school district and the team. So that is Friday afternoon. If you can attend, that would be great to show support for them. So that is happening also. I did last week go to the CSLI class and attended that, which was a great opportunity for growth and both personal and professional development. So I want to thank you for allowing me to attend that. And that's all that we have. Thank you.
Great, thank you. Well, if that pretty much gets everything that was on our agenda, if there's nothing else, I would suggest that we adjourn. If there's no objections, we'll call it a night. We're adjourned. Thank you all. Take care.
Congratulations, Natalie.
Oh, yes, congratulations. Yeah.
What time is the back?